So when we talk about the risks of deep plane surgery, they are similar to most other facial surgeries, and we group them into three major categories. There are scars, there are plumbing issues, as well as movement issues. So when we talk about scarring, the beauty in deep plane face and neck lift surgery is that much of the tension is not placed on the skin, which is then being pulled apart. It really is on the deeper layers like the muscle. And so for that reason, we don't have to crank or compensate for a poorly done facelift by pulling on the skin. We allow the skin to lay very nice and flat, and we just remove the excess. And so for that reason, because the skin is not closed under any tension, it really does heal very, very well, and we infrequently have to do any type of scar revision for that reason. Scarring is usually never an issue for my patients. I can say that with all honesty. The second issue is a plumbing issue. We either produce too much liquid or we don't produce enough liquid. Liquid that we typically talk about in face and neck lift surgery is blood. We have minor blood vessels responsible for supplying sensation and oxygen to our skin. And we have major blood vessels responsible for supplying circulation and oxygen to our brain and our vital structures in our face. We control the major ones during surgery, but the minor ones are responsible for improving the skin quality and healing in a postoperative period. If for whatever reason one of the major blood vessels or minor blood vessels sprouts a leak after surgery, the patient is at risk of forming an organized blood collection or a hematoma. A hematoma is not a life-threatening emergency. It usually is clotted off by the body, but it presents as a cosmetic nuisance during the healing period. And so for that reason, we follow you very closely after surgery, and if there's any concern of an organized blood clot, then we see you in clinic immediately, we stick a little needle inside, we drain it, and apply compression afterwards. It may be that we have to do that several times during your healing process in order to prevent a contour irregularity as the skin is healing on top of the muscle. The second kind of plumbing issue that we encounter is not enough fluid being produced. And this can be in the context of a patient who has done multiple skin treatments in the past that may have affected their subdermal plexus. This also applies to people who have a history of smoking, unfortunately. And we know that when you beat up the skin or if you smoke a cigarette, those small blood vessels tend to shrivel up and they cannot supply oxygen to your skin in the early, immediate wound healing phase. And if that so happens, you may experience a condition called tissue ischemia, which means that oxygen is not being delivered to the skin, or if not recognized early enough, this can lead to frank necrosis, which is skin death and sloughing of the skin afterwards. If we feel that at a certain point your skin is at risk for not healing well after surgery because of several treatments done or for whatever reason is presented to us after surgery, we may consider sending you for hyperbaric oxygen treatment. This is one of those therapies that scuba divers will sit in order to pump high flow oxygen into their body. And so the oxygen will replace the work that those small little blood vessels should have served during your healing process. And again, if we recognize it early enough, most people can escape without any lasting damage. The other plumbing issue we sometimes see is that inflammatory fluid or salivary fluid can leak into the neck, and we treat it frequently similar to a hematoma in that we have to drain it and recognize it, and then we see you very frequently in the post-op period. The risk of either of those happening is about 2%, and that will happen from time to time in our practice. And then the last major category of risks when we talk about deep plane face and neck lift surgery are nerves. There are nerves that supply sensation to our face. Most patients will complain of a little bit of numbness in their earlobe and around the top of their neck and the surrounding area for a period of a year after surgery, but most of the sensation will come back over time. But then there are also motor nerves that are responsible for lifting our eyebrows and the corner of our mouth during the healing process. I will say that it is highly, highly unlikely that if you are presented with nerve damage after surgery, that this is a permanent issue. And this is always a temporary issue. Most nerves will come back between 4 and 16 weeks, and it generally depends on the age and health of the patient, as well as how large the nerve injury was. So those are the three risk categories to face and neck lift surgery. Of course, there are some more minor ones that may occur, but these are the three that you really should be aware of prior to undergoing surgery. So what is recovery during deep plane face and neck lift surgery? Typically, we will divide our healing into a surgical recovery as well as a cosmetic recovery. Now, depending on your age, previous treatments or surgeries that you've had done, your health status, any types of non-surgical treatments that you may have undergone in the past, your recovery will differ but it generally ranges between 3 to 5 weeks for a surgical recovery and 3 to 5 months for a cosmetic recovery. Surgical recovery does not mean that you are perfectly well healed and you will not feel self-conscious by going back out onto the street. We refer to this period as being restaurant ready. That means that a waiter in a dimly lit restaurant cannot tell that you've had anything done. And so most of the unnatural swelling and bruising has dissipated by this point, and general incision lines can be concealed quite well with makeup. This is not esthetician or hairdresser ready. It does not mean that people who are examining you very closely cannot tell that something has been done, but most people will be able to conceal it by passers-by at this period of time. Cosmetic recovery is when the full skin and muscle tends to heal after surgery. Any little lumps and bumps in your skin, scars that are taking a little bit longer to heal, unnatural swelling in the body will have generally dissipated by this time. But it doesn't mean that you're fully healed. Full healing after surgery can take up to 12 months. But in general, most people can go to major events. They can talk face to face with somebody they know very well. They can be in front of the camera if they've had surgery 3 to 5 months prior.